Okay, this is very high yield and important concept. ITP, immune thrombocytopenic purpura. So we got a young woman and she's got some mucocutaneous bleeding. She's got severe thrombocytopenia, less than 30,000 platelets. She's got a hematocrit that's normal and everything is like kind of normal. And so you ask yourself, okay, what is happening? And the answer is immune destruction of the platelets. Okay, so we're thinking about a couple things here. And our differential diagnosis should kind of be thrombocytic purpura, aplastic anemia, ITP, bone marrow infiltration, DIC maybe is on our list, right? And so we go down the list and we have to know why it's not bone marrow aplasia. Well, that would cause pancytopenia, not isolated, just the platelets being low, right? So bone marrow, why would the hematocrit be normal in bone marrow? So it's not that. Malignant infiltrating marrow, that's like a malignancy, and for that you'd see hepatosplenomegaly, and that's not seen here. DIC, that would show decreased fibrinogen and increased PT, and also cystocytes. You're super duper duper sick in this one, not what it looks like. Splenic sequestration, this is super important that they say that she does not have splenomegaly, right? Because if it's sequestering to the spleen, then the spleen is going to be enlarged. And so it's not going to be a splenic sequestration disease. Von Willebrand, the platelet count is normal, but the platelet function is impaired. Okay, so it's not going to be von Willebrand's disease. All right, so just going down the list, what's important about this question is not the bone marrow because the retic is normal, not infiltrate because then it'd be pancytopenia, not DIC because that'd be accelerated platelet consumption and you'd show decreased fibrinogen and elevated prothrombin time. It just would take longer, and that's not the case here. The labs are normal. Autoimmune destruction of the platelets by IgG antibodies is what's happening here, and that causes thrombocytopenia, ecchymosis, and mucosal bleeding. Platelet sequestration, no, because the spleen is normal, and von Willebrand, no, because normal platelet count and bleeding time and partial thrombin time would be prolonged, and so that's not consistent with what this patient's got, right? Because you'd have normal platelets and von Willebrand. It's fine. The bleeding time is what's going to be prolonged in that one. So it's not von Willebrand. All right, we'll see you in the next one. Hopefully this is helpful. If it was, like and subscribe.